Hello all, today we are going to discuss about disorders of skeletal muscle. Definition: skeletal muscle disease or myopathies or disorders with structural changes or functional impairment of muscles. Diagnosis of myopathy is based upon clinical features of patients and investigations. Types: muscular dystrophies, neuromuscular disorder, muscle injury. Inflammatory myopathies, other muscle disorders. Muscular dystrophies. Muscular dystrophies are a group of genetic diseases that cause progressive weakness and degeneration of skeletal muscle. Progressive weakness means gradual decline in muscle strength over time. Degeneration means refers to structural damage. Causes: it is caused by mutations in genes that are essential for building and maintaining healthy muscles. These mutations disrupt the production of proteins needed for muscle function. Over time, muscle tissue may be replaced by fat and connective tissues. Types of muscular dystrophy: Duchenne muscular dystrophy. This is the most common and severe form, primarily affecting boys, causing rapid muscle degeneration, often leading to loss of walking ability in early teens. Then Becker muscular dystrophy, a milder form of muscular dystrophy with slower progression. Symptoms typically appear later in childhood or adolescence. Then myotonic dystrophy. Myotonic dystrophy is characterized by myotonia, that is prolonged muscle contraction, means delayed relaxation of muscle after contraction, as well as muscle weakness. For example, difficulty releasing grip after holding something. It can affect multiple body systems. Diagnosis typically involves a combination of physical examination, muscle biopsies, genetic testing, electromyography, that is EMG. So this EMG is used to evaluate the electrical activity of muscular and nerves that controlling them. Next, treatment. There is currently no cure for muscular dystrophy. Treatment focus on managing symptoms, slowly disease progress, and improving quality of life. This may include physical therapy, occupational therapy, medications, and supportive care. Genetic counseling is essential for individuals with a family history of and to understand the risk of passing the condition on their children. Then neuromuscular disorders. Neuromuscular disorders are a diverse group of conditions. The diverse means different, that affects the nerve that control voluntary muscles. Somatic motor nerve is a voluntary muscle. Function of voluntary muscles are carry signals from brain and spinal cord to skeletal muscles, allow conscious control of movement, walking, writing, lifting objects. This disruption in communication between nerves and muscles can lead to a variety of symptoms, most notably muscle weakness. Types of neuromuscular disorders, that is amyotrophic lateral sclerosis, myasthenia gravis, peripheral neuropathy, spinal muscular atrophy. First of all, we can discuss about amyotrophic lateral sclerosis. It was formerly known as Lou Gehrig's disease. This name comes from famous baseball player. It is a progressive damage and loss of structural or functional of neurons in the brain and spinal cord. It is a neurodegenerative condition that affects the nerve cells of brain and spinal cord. It targets motor neurons. Motor neurons are nerves that voluntarily control muscle movement. Function of motor neurons. These regulates voluntary muscle movements, example talking, chewing, arms and legs, movement of arms and legs, and breathing. Neurons communicate with muscles to tell them move. Amyotrophic lateral sclerosis disturbs the communication. The message sent from neurons to muscles break up and don't get enough clearly. As a result of poor connection, neurons can't take any new calls. Then myasthenia gravis. It is a chronic autoimmune disorder in which antibodies destroys the communication between nerves and muscles, that is neuromuscular junction, resulting in weakness of the skeletal muscles. Myasthenia gravis affects the voluntary muscles of the body, especially those that control the eyes, mouth, throat, and limbs. A myasthenia gravis crisis can involve difficulty in swallowing or breathing. Here what happens means body produce antibodies against acetylcholine receptor, that is neurotransmitter, so nerve signals cannot properly stimulate muscle resulting weak muscles contraction. So here amyotrophic lateral sclerosis is due to neurodegeneration and myasthenia gravis is due to problem in neuromuscular junction, not nerve muscle itself. Then peripheral neuropathy. Damage to the peripheral nerves often causing numbness, tingling, and weakness. Peripheral nerves means nerves outside the brain and spinal cord. Tingling means sensation of slight pricking pins and needles. Then spinal muscular atrophy. A genetic neuromuscular disorder characterized by degeneration of motor neurons, lower motor neurons in spinal cord, causing weakness and wasting of voluntary muscles. It is caused by mutation in SMN1 gene. Then symptoms: muscle weakness, muscle pain, muscle cramps or spasms, numbness or tingling, difficulty with coordination, and fatigue. Diagnosis and treatment: physical examination, EMG, that is electromyography, nerve conduction studies, diagnostic study to evaluate the function of peripheral nerves by measuring how quickly electrical signal travels along them, helping nerve damage or disorder identification. Then muscle biopsy, genetic testing. Treatment: medication, physical therapy, occupation therapy, and supportive care. Then muscle injuries. Muscle injuries are damage to muscle fibers, common, and they can range from minor strains to severe tears. Causes: falls, collisions, sudden forceful movements. Types: muscle strains and tears, tendinitis. Treatment: RIC, that is rest, ice, compression, and elevation. Pain medications, physical therapy, and surgery. The next one is inflammatory myopathies. Inflammatory myopathies are a group of rare disease which is considered as autoimmune disease characterized by chronic muscle inflammation leading to muscle weakness and in some cases muscle pain. Types: polymyositis cause muscle inflammation and weakens primarily in the proximal muscles. Dermatomyositis similar to polymyositis but also includes characteristic skin rashes. Symptoms: muscle weakness, muscle pain, fatigue, difficulty in swallowing, that is dysphagia, shortness of breath, skin rash in dermatomyositis. Then diagnosis. When we are coming to diagnosis, physical examination, blood tests, to check for muscle enzymes and antibodies. Then EMG, that is electromyography, then muscle biopsy, MRI. Treatment. There is no cure, but treatment focuses on managing symptoms and slow disease progression. The medication we can give to these conditions are corticosteroids. Corticosteroids are given to reduce the inflammation, and immunosuppressant medications, then physical therapy. Some of the other muscle disorders are sarcopenia. Sarcopenia means shrinking muscle with age. So, it is a progressive and generalized skeletal muscle disorder involving the accelerated loss of muscle mass, strength, and function. Essentially, it is the age-related decline in muscle mass, strength, and performance. Causes age-related decline. Muscle mass naturally decreases with age, typically starting around 40 and accelerating after 60 or 70. Lifestyle factors: poor nutrition and lack of exercise. Hormonal changes, change in hormone levels like decreased testosterone and growth hormone. Then chronic disease conditions. Then we can see about prevention and management. We can prevent this condition by exercise, adequate protein intake, healthy lifestyle, and vitamin D consumption. Then the next condition is rhabdomyolysis. It is often called rhabdo. Is a serious medical condition that occurs when damaged skeletal muscle breaks down rapidly. This breakdown releases muscle contents, that is protein and electrolytes myoglobin, into the bloodstream, which can cause severe complications, most notably kidney damage. The kidney filter myoglobin from the blood, but high levels can overweigh them, leading to kidney damage or even kidney failure. Then we can see about the causes. The causes for rhabdomyolysis are trauma, extreme muscle strain, medications and toxins, infections, prolonged immobility, heat stroke, genetic muscle disorder. Symptoms. The symptoms can vary, and some people may not. Common signs include muscle pain, tenderness or weakness, dark colored urine, that is reddish brown, decreased urine output, muscle swelling, fatigue, nausea and vomiting. Diagnosis. We can diagnose this condition by blood test to measure the creatine kinase levels in blood, then urine test to detect myoglobin. So in this condition, myoglobins may be presented in the urine. Then we can finally see about treatment. Treatment may involve IV to flush myoglobin from kidneys. Electrolytic imbalance or imbalances are corrected. In severe cases, dialysis may be necessary. Then now we can see about disorder of smooth muscles. Smooth muscle is a type of involuntary muscle found in the walls of internal organs and blood vessels. So definition, disorder arises when the smooth muscles cannot contract or relax properly. This can lead to a variety of problems depending on the affected organs. So, where the smooth muscles found? So, in blood vessels that controls blood flow by constricting or dilating the vessels. Digestive tract, it propels food through esophagus, stomach and intestine via peristalsis. In respiratory system, it regulates the diameter of airways. In urinary system, it controls bladder emptying. In reproductive system, uterine contraction during childbirth. In eyes, it adjusts pupil size to control light entering the eye. Causes of smooth muscle disorders. So, the causes may include genetic mutations, autoimmune disease, hormonal imbalance, nerve damage, and inflammations. Here, now we can discuss about disorder of smooth muscles. The disorders may include multisystemic smooth muscle dysfunction syndrome, vascular disorders, gastrointestinal disorders, respiratory disorders, urinary disorders. First, we can discuss about multisystemic smooth muscle dysfunction syndrome, that is MSMDS. It is a rare genetic disorder characterized by widespread smooth muscle dysfunction, leading to problems in various organs and systems including the heart, blood vessels, bladder and intestines. Then causes for multisystemic smooth muscle dysfunction syndrome include, it is caused by mutation in the ACTA2 gene. Mutation means change in DNA sequence, which encodes type of actin protein essential for smooth muscle function. Then we can see about clinical manifestation for cardiovascular congenital heart defects like patent ductus arteriosus. Patent ductus arteriosus means opening between two major blood vessels leading from the heart, pulmonary artery and the aorta. Then aorta and other arterial aneurysms. Aneurysms means ballooned and weakened area, and pulmonary hypertension are very common. Then neurologic moya. It is a condition that is a rare progressive condition that narrows the carotid artery in the neck, reducing blood flow to the brain, like CVD, that is cerebral vascular disease, and congenital mydriasis, that is fixed dilated pupils, are also characteristics. Then gastrointestinal hypoperistalsis, reduce gut motility, and malrotation are frequently observed. Then urological hypotonia of the bladder and urinary tract tract issues are common. Then hypotonia means weak muscle tone. Then we can see about diagnosis. It can be challenging due to wide range of symptoms and the variety of the condition. Genetic tests for ACTA mutation is crucial for confirmation. Then we can see about management. So there is no cure for MSMDS and treatment focuses on managing complications and improving quality of life. This may involve surgery for aneurysms, medications for hypertension and other supportive care. Cardiovascular disease. Hypertension, the smooth muscle in artery walls contract excessively, increasing resistance to blood flow. Atherosclerosis, plaque buildup narrows arteries and smooth muscles reacts by further constricting, worsening the problem. Then aneurysm, weakened smooth muscle in blood vessels walls can cause them to bulge or rupture. Then gastrointestinal disorders. In digestive tract, irritable bowel syndrome, abnormal smooth muscle contractions in the intestine cause abdominal pain, cramping, bloating and change in bowel habits. Then achalasia. So achalasia means the smooth muscle of the lower esophageal sphincter fails to relax, making it difficult to swallow. Then we can see about respiratory disease, that is in lungs. First we can see about asthma. Smooth muscle in the airways constrict excessively, causing wheezing, shortness of breath and cough. Then COPD. Chronic, that is chronic obstructive pulmonary disease. So this can damage the lungs and airways, can lead to smooth muscle dysfunction contributing to airway obstruction. Urinary disorders. Overactive bladder. Uncontrolled contractions of the bladder smooth muscles leads to frequent and urgent urination. Then reproductive disorders. In reproductive disorders, uterine fibroids, that is benign tumors of the uterine smooth muscles, can cause heavy bleeding and pelvic pain. Then finally we can see about diagnosis and treatment. In diagnosis, medical history and physical examinations are taken. Ultrasound, CT, MRI, then endoscopy and manometry are taken. Manometry is a measurement of pressure in GI tract. Then biopsy, genetic testing. Then we here come to treatment. Medications like smooth muscles, relaxant, stimulants are taken, lifestyle modifications and surgical procedures. Then we can see about disorder of cardiac muscle. A disorder of cardiac muscle is also known as cardiomyopathy. This is a disease that weakens the heart muscle, making it hard for the heart to pump blood efficiently. There are several types of cardiomyopathies. First one is dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy. These disorders can lead to serious complications including heart failure, arrhythmias, that is irregular heart rate, then even sudden cardiac death. Dilated cardiomyopathy. We can see some of the characteristics in dilated cardiomyopathy, that is enlargement of the heart chambers, primarily the left ventricle and muscle weakens, thinning of the ventricular walls, impaired systolic function, globular appearance of the heart on imaging. Then causes. The causes may be idiopathic, that is we don't know the clear reason. Then genetic factor, viral infections like myocarditis, alcohol abuse, drug toxicity, example chemotherapy, coronary artery disease. Clinical presentation. Heart failure symptoms like dyspnea, fatigue and edema. In arrhythmia, atrial fibrillation, ventricular or tachycardia. Embolic events due to blood stasis. In hypertrophic cardiomyopathy, thickening of the ventricular walls partially in intraventricular septum, making it hard for the heart to pump blood. So, impaired diastolic function is potential for left ventricle outflow tract obstruction and myocardial disarray. Causes, primary genetic, then clinical presentation, asymptomatic in many cases, dyspnea, chest pain, palpitations, sudden cardiac death, especially in young athletes, murmur related to outflow obstruction, restrictive cardiomyopathy, stiffness of the ventricular walls, impaired diastolic filling, relatively preserved systolic function, amyloid deposition or other infiltration of myocardium. Causes, amyloidosis, abnormal protein produced by bone marrow, buildup of amyloid protein in the heart, kidney, liver and other organs. Then sarcoidosis, cause lumps or nodules in lungs, lymph nodes, skins. Then endomyocardial fibrosis, fibrous tissues deposits in endocardium, primarily affects ventricular. Then radiation therapy. Clinical presentation, heart failure symptoms, right-sided predominant, edema, ascites, hepatomegaly and arrhythmias. Diagnosis, history and physical examination, ECG, that is electrocardiogram, echocardiogram, MRI, genetic testing, echomyocardial biopsy, blood tests like BNP. BNP means hormone released by heart. It is used in diagnosing heart failure. Then NT-pro and BNB levels and tests to elevate for organ damage. Treatment, general principles to treat underlying cause, manage heart failure symptoms, specific treatments, DCM medications, ACE inhibitors, that is beta blockers, diuretics, implantable cardioverter defibrillator, that is ICD, cardiac resynchronization therapy and heart transplantation. Septal reduction therapy, treatment of underlying cause of diuretics, management of arrhythmias. Thank you.